Biosynthesis pathway for androgen synthesis. Biosynthesis of androgens, cholesterol, LH hormone, cholesterol desmolase, pregnenolone. Then 17 alpha hydroxylase acts on it. Then it converts pregnenolone to 17 hydroxypregnenolone. Then 1720 lyase acts on 17 hydroxypregnenolone, which converts it into dehydroepiandrosterone. Then 3 beta hydroxysteroid dehydrogenase acts on dehydroepiandrosterone and converts it into androstenedione. Then 17 beta hydroxysteroid dehydrogenase acts on androstenedione and converts it into testosterone. Then 5 alpha reductase acts on testosterone and converts it into dihydrotestosterone. Fetal skull dimensions. These are fetal skull dimensions. Engaging diameter, length, presentation. Engaging diameter, submentobragmatic, length 9.5 centimeters. Presentation, face. Mentovertical, 14 centimeters. Brow, presentation is brow. Occipitofrontal, length 11.5 centimeters. Presentation, vertex. Suboccipitobragmatic, length 9.5 centimeters. Presentation, vertex. Suboccipitofrontal, length 10 centimeters. Presentation, vertex. Submentovertical, 11.5 centimeters. Presentation, face. Submentobragmatic, submentovertical. Presentation is face. Submentobragmatic, submentovertical. Presentation is face. Submentobragmatic, length 9.5 centimeters. Submentovertical, length 11.5 centimeters. Mentovertical, presentation is brow, length 14 centimeters. Mentovertical, presentation is brow, length 14 centimeters. Occipitofrontal, suboccipitobragmatic, suboccipitofrontal. Presentation is vertex. Occipitofrontal, suboccipitobragmatic, suboccipitofrontal. Presentation is vertex. Occipitofrontal, length is 11.5 centimeters. Suboccipitobragmatic, length is 9.5 centimeters. Suboccipitofrontal, length is 10 centimeters. Anteroposterior diameters. Biparietal, 9.5 centimeters. Bitemporal, 8 centimeters. Shortest diameter of fetal skull is bimastoid, 7.5 centimeters, less than bitemporal, which is 8 centimeters. Longest diameter of fetal skull is mentovertical, 14 centimeters. Afterwards, submentovertical or occipitofrontal, which is 11.5 centimeters. Longest diameter is mentovertical. Shortest diameter is bimastoid, 7.5 centimeters, which does not engage. Cytohormonal study of vaginal epithelium. Cytohormonal study of vaginal epithelium. Layer, parabasal and basal, then intermediate cell, then superficial cells. Cytohormonal study of vaginal epithelium, parabasal and basal layer. Cell characteristics, small, round and basophilic with large nuclei. Hormones, lack of hormonal activity. Age of the woman, childhood until puberty. Menopause with atrophy. Parabasal and basal age of woman is childhood until puberty. Menopause with atrophy. In these age groups, parabasal and basal layer. Intermediate cells, transparent and basophilic with vesicular nuclei. Hormones are progesterone, androgen, corticosteroid. Age of woman is pregnancy at an early transition of menopause. Intermediate cells, superficial cells, large cells with pycnotic nucleus, acidophilic on staining, large cells with pycnotic nucleus, acidophilic on staining. Hormones, estrogen. Age of woman, reproductive period, pre-ovulatory period. Superficial cells or reproductive period or pre-ovulatory cells. Parabasal and basal is childhood until puberty and menopause with atrophy. Parabasal and basal. Intermediate cell at an early transition of menopause and pregnancy. Pregnancy, intermediate. Childhood and menopause, parabasal and basal. Superficial, reproductive. Nerve supply in pelvis. Nerve supply in pelvis. Organ, perineum, vulva, lower vagina. Spinal segments S2 to S4. Nerves, pudendal, inguinal, genitofemoral, posterofemoral, cutaneous. Upper vagina, cervix, lower uterine segment S2 to S4. Pelvic parasympathetic. Uterine fundus, proximal fallopian tubes, broad ligament. T11 to T12 L1. Sympathetic via hypogastric plexus. Outer two-thirds of fallopian tubes. 19 T9 to T10. Sympathetic via aortic and superior mesenteric plexus. Sympathetic via aortic and superior mesenteric plexus. Ovaries T10 to T11. Sympathetic via renal and aortic plexus and celiac and mesenteric ganglia. Sympathetic via renal and aortic plexus and celiac and mesenteric ganglia. Perineum, vulva, lower vagina. Perineum, vulva, lower vagina. Spinal segments S2, S4. Nerves are pudendal, inguinal, genitofemoral, posterofemoral, cutaneous. Upper vagina, cervix, lower uterine segment S2 to S4. Nerves pelvic parasympathetic. Uterine fundus, proximal fallopian tube, broad ligament T11 to T12 L1. Nerves are sympathetic via hypogastric plexus. Outer two-thirds of fallopian tube T9 T10. Sympathetic via aortic and superior mesenteric plexus. Ovaries T10 to T11. Sympathetic via renal and aortic plexus and celiac and mesenteric ganglia. Contents of broad ligament. One tube, fallopian tube. Two ligaments, round ligament of uterus, ovarian ligament. Contents of broad ligament are one tube, fallopian tube. Two ligaments, round ligament of uterus, ovarian ligament. Round ligament of uterus, ovarian ligament. Two arteries, uterine artery, ovarian artery. Two arteries, uterine artery, ovarian artery. Two nerve plexus, uterovaginal plexus, ovarian plexus. Two nerve plexus, uterovaginal plexus, ovarian plexus. Three embryological remnants, eubuphron, parophron, Gartner's duct. Olfean body, Olfean duct. Other structures, lymph vessels and lymph nodes. Fibrous connective tissue. Contents of broad ligament. One tube, fallopian tube. Two ligaments, round ligament of uterus, ovarian ligament. Two arteries, uterine artery, ovarian artery. Two nerve plexus, uterovaginal plexus, ovarian plexus. Three embryological remnants, eubuphron, parophron, Gartner's duct. Other structures, lymph vessels, lymph nodes. Fibrous connective tissue. Broad ligament and its contents. Fallopian tube. Meso-ovarian, ovarian artery, ovary, round ligament of uterus, ovarian ligament, uterine artery, broad ligament. Supports of uterus, primary supports, muscular or active support of uterus, pelvic diaphragm, perineal body, urogenital diaphragm. Muscular or active support of uterus, pelvic diaphragm, perineal body, urogenital diaphragm. Ligamentous or fibromuscular or mechanical support. Transverse cervical ligaments or Meckenroth or cardinal ligament. Transverse cervical ligaments of Meckenroth or cardinal ligament. Transverse cervical ligament of Meckenroth or cardinal ligament. Uterosacral ligament, round ligament of uterus. Pubocervical ligaments, uterine axis. Transverse cervical ligament of Meckenroth or cardinal ligament. Uterosacral ligament, round ligament of uterus. Pubocervical ligament, uterine axis. Uterosacral ligament, round ligament of uterus. Pubocervical ligament, uterine axis. Secondary supports formed by peritoneal ligaments. Secondary supports formed by peritoneal ligaments. Broad ligament, uterovesical fold of peritoneum, rectovaginal fold of peritoneum. Broad ligament, uterovesical fold of peritoneum, rectovaginal fold of peritoneum. Cytochemical origin of placental hormones. Cytochemical origin of placental hormones. Hormones of placenta. Their cytochemical origin. Hypothalamic like releasing hormones. Corticotropin releasing hormone. CRH. Cytochemical origin. Cytotrophoblast and syncytiotropoblast. Gonadotropin releasing hormone. Cytochemical origin is cytotrophoblast and syncytiotropoblast. Thyrotropin releasing hormone. Cytotrophoblast and syncytiotropoblast. Corticotropin releasing hormone. Gonadotropin releasing hormone. Thyrotropin releasing hormone. Corticotropin releasing hormone. Gonadotropin releasing hormone. Thyrotropin releasing hormone. Chemical origin is cytotrophoblast and syncytiotropoblast. Pituitary like hormones. Adrenocorticotropic hormone. Cytochemical origin is syncytiotropoblast. Human chorionic gonadotropin, syncytiotropoblast. Human chorionic thyrotropin, syncytiotropoblast. Human placental lactogen, syncytiotropoblast. All pituitary hormones, pituitary like hormones, adrenocorticotropic hormone, human chorionic gonadotropin, human chorionic thyrotropin, human placental lactogen. All are from syncytiotropoblast. Growth factors: inhibin, activin, transforming growth factor B. Inhibin, activin, transforming growth factor B. They are from syncytiotropoblast. IGF-1 and 2, epidermal growth factor, syncytiotropoblast. Inhibin, activin, transforming growth factor B. Inhibin, activin, transforming growth factor B. They are from syncytiotropoblast. IGF-1 and 2, epidermal growth factor. Syncytiotropoblast. Steroid hormones: estrogen, phytoplacental unit. Progesterone before 6 weeks, corpus luteum, thereafter placenta. Cortisol, decidua or adrenal. Estrogen, phytoplacental unit. Progesterone before 6 weeks, corpus luteum, thereafter placenta. Cortisol, decidua or adrenal. Other pregnancy proteins: pregnancy specific beta 1 glycoprotein, pregnancy associated plasma protein A, pregnancy specific beta glycoprotein PS beta G, pregnancy associated plasma protein A, syncytiotropoblast. Relaxin, corpus luteum, decidua, placenta. Corpus luteum, decidua, placenta. Prolactin, decidua. Atrial natriuretic peptide, atrial myocyte. Early pregnancy factor, activated platelet ovaries. Activated platelets ovaries. pregnancy specific beta 1 glycoprotein, pregnancy associated plasma protein, cytochemical origin is in situ trophoblast, relaxin, cytochemical origin is corpus luteum decidua placenta, prolactin, cytochemical origin is decidua, atrial natriuretic peptide, atrial myocyte, early pregnancy factor, activated platelets, ovaries.